Hello, friends. Thank you for this opportunity to be present here. This is my second time at the Geneva Digital Health Hub. Last year, I had the privilege of putting this across to you when it was, at the time, we had saved 100 lives through this project. Today, we are at a different stage after scaling up. So I just wanted to go back a bit. This is a story of a public health emergency, which is commonly known as the overdose crisis across the world, and it is affecting. Let's put it that way: being an emergency-trained physician and a public health professional, I'm very passionate about this essentially because it's affecting the next generation, a whole youth mental health. And across the world, this is becoming declared as a public health emergency in many countries. So I started off, I'm from Australia, but I was working in Canada for 5-6 years when this emergency was declared. And the solution was born out of that. We worked with the emergency services in creating a digital health solution, which is known as a Lifeguard. It was launched during pandemic when there were 52% overdose deaths as compared to COVID at that time. And we managed over a period of time, 100 lives is what we tracked, but there's a lot more lives saved and prevented at that time. So this was the solution that we started off with, which is now in the 6th version. What it does, it is a self-driven app that connects to emergency services should you overdose and have an emergency. So there are the various methods of doing this, and I'm sure that there are people who have, it's a sensitive area, so how do we protect identities? How do we do this? All of this has been worked out through direct connections, through blockchain technology and other digital methods, which actually hides identities at the same time gets emergency in the country. So we work closely with the emergency services such as 911, 000 in any country. So at the moment, this solution is now being, it's across Canada and it's being launched in 2 other countries, including Australia. So this is where we are at this point. At this stage, being a prevention-oriented physician, so I looked at what are the other ways in which we can scale this, because there is a certain reluctance when it is going out into a general public. We cannot really trace. If you have an app on your with you, does not mean that you are you're going to overdose. So it could be just out of curiosity. It could be a physician. So we looked at what are the ways in which people can use it, and out of that, the vertical segmentation of this was born. And this is for 2 of the options that we have at the moment. One is aimed at only construction industry workers, which is very common in this category. And the other, which is the most important one at this point, is in many countries, drug crisis is also, there is post-incarceration, and people come out of post-incarceration and they still go back to overdosing themselves. And to prevent this, we sort of said, maybe we can wean people away from this crisis rather than trying to treat or prevent the overdose. Yes, we do need to prevent the overdose, but we can wean people away gently at the same time by looking at their needs. And that's how the 3rd version was born for people who are post-incarceration. While it does have a certain level of overdose protection, it offers other options so that people do not go back to their addictions. Despite all of these, we had a challenge. This is a SaaS-based or software as a SaaS-based solution. We then looked at social housing and prevention strategies in social housing, and that's where this hardware